let's answer this question, right? So this is a prioritization question. So look at us. I'm going to answer this question now. For this particular question, I'm going to see they all have diagnosis. I can see diagnosis right here, or the problem, right? So what the patient is experiencing right here. So I cannot say I can eliminate anything at this point because everything will have diagnosis. Now, the next thing I wish is to use is my framework, which I call the CNR, right? Cardiovascular, neuro, and respiratory. So anything, because on the NCLEX exam, NCLEX don't want you to prioritize using the diagnosis. A lot of students use diagnosis. We don't use diagnosis. We use what the patient is experiencing to prioritize. So I link what the patient is experiencing to any of this issue right here. Are they experiencing a cardiovascular issue, a neurological issue, a respiratory issue? Remember, I'm not talking about the diagnosis. I'm talking about what they're experiencing. Now, they said the client is irritable when awake. That's a neurological issue right there. Right. Those are my top priorities. Let me tell you something. Before a patient can die, the CNR need to be affected. This is your three body system that can cause death to the patient. The remaining seven body system, because we have 10 body system, right? The remaining seven body system needs to affect this three body system before the patient can die. That's one thing you need to know. The principle of dying, right? This three body system need to be affected before the patient can die. This seven body system need to affect any of these three body system before the patient can die. That's what you need to know. So now, yeah. So I'm thinking about it. So all this will be my level one patient. So I'm seeing neurological. I'm immediately putting what to level one right here. I'm seeing something having to do with drainage of fluid, yellow fluid. I can be thinking about infection. So if I'm thinking about infection, I'm thinking about what immune problem, right? Due to infection, stuff like that. So infection is part of the seven body system. I already have issue with what neurological, which is irritable. So I'm going to still keep my level one. I'll remove this. Right. So I'm seeing something with the skin. Right. Skin is part of the seven body system. It's not related to the CNR. I can remove this because level one will take priority. Right. I'm seeing something to do with swollen and cool. These have to do with cardiovascular. And you can see we have C right here. So, right. So, cardiovascular, I'm going to put this level one. So, I have two level one right here. I have 1 and 4. Right. 1 and 4 as my two priority right here. So, now, and I need to now look at the two situations closely to know who is more of priority. Right. Now, this client, the NCLEX is saying they are irritable. This client, the NCLEX is saying they are swollen and cool to touch. Now, irritable when awake every 2 hours during the night. Now, when we are dealing with neurological issue, now the biggest complication we are thinking about is ICP. We are watching out for level of consciousness. Patient is not responsive and all that kind of stuff. Right, that's what we are thinking about. Swollen, cool, cardiovascular issue, we are thinking about circulatory problem, complication. Right, that's what we are thinking about. So, but right here, they said the client is irritable, but they did not say they are not awake or that kind of stuff, or they have level of consciousness issue or sign of ICP, nothing like that. Unlike this patient, they are talking about swollen, cool. There's nothing we are thinking about. We are automatically thinking about circulatory complication. So we still need more information to show that this patient is having problem. But this is already showing that the patient is having problem. So if I'm going to prioritize between 1 and 4, my answer will definitely be what? 4. You can see how it works, right? So this is how you can apply what principle. Now, there's another secret or bonus I'm going to leave you with. When you are trying to prioritize, you are not really prioritizing your knowledge of the condition, right? You are prioritizing the body system that is affected. Now, this is a neurological complication, concussion. Now, since I know it's a neurological condition, I'm thinking about complication. What are those things I need to watch out for to show that a patient with a neurological condition is experiencing a life-threatening situation? That's what I'm thinking about. So if I'm seeing anything right here that is related to life-threatening situation, I'm selecting that. Now, this is an issue with a certain procedure, which is cast. What's the sign that shows this patient is experiencing complication? We are thinking about compartment syndrome, which is a complication. This is the sign. There's no sign that this patient is experiencing complication in number one. I don't need to know concussion. All I just need to know is neurological what? Condition complication. I just want to know them in general, right? Neurological complication. That's how the NCLEX work. NCLEX wants you to know neurological complication, cardiovascular complication, right? Respiratory complication, because NCLEX know you have a lot of disease condition. So NCLEX is not really expecting you to know every disease condition complication because they might likely be the same. So, but if you know cardiovascular complication, neurological complication, respiratory complication, when you are on the NCLEX exam, you can easily answer it. Right. Complication related to procedure, because this is a procedure. So you need to know those procedure: musculoskeletal procedure, respiratory, cardiovascular, and then the complication. This is a complication related to the skin. These are skin complication. This is a neurological complication. You see how the NCLEX work, right? So when we are studying, we should be smart with our studying so that we can be able to, right, gain a lot of knowledge.